Hi, I've been asked to talk about eye rejuvenation, and I'd like to talk to you first about changes that happens on your face that then affects how your eyes appear on the mirror, on a selfie, on a video chat, etc. So one of the things is to do with the bone. So your eye socket actually gets bigger as we get older. When that happens, your eye has to sit back a bit more, and therefore you have more of a sunken eye appearance. The support structure for the eye is not a huge amount of support there. So anything that happens around or below the eye then has a knock-on effect. So our cheeks have these fat pads that help to give structure and support and shape to our face. That will change as we get older. It gets smaller and it slides down, and then it has a knock-on effect on the eye area. And the lack of soft tissue support in the eye then makes us get these eye bags that some people are more prone to getting. There is a thin layer of soft tissue support between the muscles and the skin, and that gets thinner as we get older. And when that happens, any muscle movement then become more pronounced on the skin, and because the skin is already gone through its own changes, it's got thinner, lost its elasticity, and has a few lines and wrinkles anyway, the muscle movements get more pronounced or become more visible, and that can happen on the forehead as well as around the eyes. The other thing is to do with the dark circles. So some people have a genetic tendency to have dark circles, and that's very difficult to treat. But for others, it might be because of these changes that are happening and the loss of soft tissue behind the skin that then brings blood vessels, etc., more closer to the skin surface, that then appear darker through from the outside. Now, a combination of the hollowness, the pigment changes, light reflection then gives your eye a bit more tired appearance, makes you look a bit more grumpy, and the lines and wrinkles become more visible, and that can make you look sad or annoyed, and affect your appearance that way when you're not doing any expressions. So there are a number of ways we treat this or we address this. So if there's a significant amount of hollowing, then you might need something like a facial filler to help to plump up that area, but we have to be very careful with the amount we use, because using too much can then make you look too puffy-eyed, etc., and you don't want to be doing that. We also have dermal filler products that are a bit more thinner, and we tend to use them around the eye to give more of a rejuvenated appearance rather than actually do something like a tear trough, which is addressing a particular area. Other options, things like mesotherapy, would include injections of skin firming agents and skin lightening agents under the skin to help to rejuvenate that. And microneedling is another good option, which helps to stimulate your collagen and helps to rejuvenate the eye area. Other treatments include things like Radara, which is a home treatment that you can do. Or creams and serums. Now, with creams and serums, it depends on the concern we are trying to treat. So some people have more puffiness around the eyes, and for that we would use something with caffeine, which helps to strengthen the eye area. Whereas if you've got lines and wrinkles, then you're looking at something, either some patented products from these medical grade skincare or retinol to try and improve skin resilience and skin strength and improve that collagen secretion, and also help to lighten pigment. Now, it's very difficult to treat the eye area aggressively because it's quite delicate. So any products that we put on, we have to be careful with the strength that we're using. So even retinol need to be at the correct strength for eye serums and not the retinol that you would use for the rest of the face. And the other thing that people get treatment for on the eyes is to do with their crow's feet. So if the muscle movement is quite strong and the pull is quite significant and they want to drastically improve that, then you'd have to look at something to relax those muscles so that the facial expressions are not as significant. That has its drawbacks. So it's a prescription medicine, You have to see a medical professional for the injection, and you don't want to be over treating that area, because then you can then end up with puffiness, because those muscles are there to help to drain your lymph, and therefore stop you getting puffy eyes when you get up in the morning. And if we over treat that, then you can actually cause puffy eyes. So there are lots of things to consider with the medical treatments, so you do need to see a specialist for a consultation and then take the next step accordingly. But generally with eye rejuvenation, so as I've discussed, there are a number of ways we treat it. All depends on what we're trying to treat. And dark circles comes up quite a lot. But like I said, it can be a genetic problem, in which case it's very difficult to treat. And the pigment lightening agents that we would use on the rest of the face are a bit too strong to be using in the eye area. So they have to be quite specific, or we're looking at weaker pigment reducing agents, which might actually take longer time to work. And with those, sometimes people give up because they've been using it for a few months, they haven't seen any noticeable changes, and therefore do not want to carry on. So that's why it's quite difficult to treat. But I hope I've covered most of the options. If you've got any particular questions, then get in touch with me, and I'll do my best to answer it. Have a lovely day.